Hello. This is to the honorable members of the Washington State Legislature, Governor Inslee, and fellow classmates. My name is Michelle Procopo. I am a nurse and a full-time graduate student at Gonzaga University in the study of advanced nursing practice. I have been an emergency room nurse for 8 years, but I have been at the bedside taking care of people since I was 17, which now at 34 means that I have been helping people for 17 years in their time of need. I wanted to take a moment today to talk to you about Medicaid, which in this state is known as Apple Health. The reason this topic is important to me is that in 17 years, I've never cared how a patient can pay. I am there for them regardless, but I know that sometimes patients don't seek care when they should. Sometimes it's because they choose not to, and sometimes it's because they simply can't afford to. Let's work together to make sure everyone gets the care they need. As you probably know, an expanded version of Medicaid has been around in Washington State since 1987, and since then it has undergone a few changes in names and was briefly in peril in the late 2000s during the recession. After the passage of the Affordable Care Act, Washington was an early adopter of the expansion, and since then there's been an ongoing development of guidelines of who qualifies for expanded Medicaid. These guidelines can be found under the Washington Code 74.09.510, also known as medical assistance eligibility. The objective of this policy is to clearly lay out who is eligible in conjunction with the federal requirements of the Affordable Care Act. You may all be wondering why I'm choosing to call attention to this topic and what does it have to do with being in a graduate program. Well, as Medicaid expansion has taken place, we've had an opportunity to examine how well we do in taking care of our patients on Medicaid and what, if any, stigma is attached to the label of having Medicaid. As I move forward with my doctorate degree, I am looking to examine what, if any, stigma is attached to patients of low socioeconomic status and how that may affect their care in the emergency department. By evaluating the guidelines of who is eligible for expanded coverage, we can look to see if perhaps continuing to expand that coverage can change what the perception of what Medicaid is. For a brief moment, let's just review some of the key elements of the eligibility criteria after the Medicaid expansion. These include children under the age of 21 who were in the foster care system, children and pregnant women, those who fall under a certain level of income, and individuals with disabilities who are working, and women under 65 who have been diagnosed with breast or cervical cancer and have no other health coverage. As I said, that was just a brief overview. Stay tuned for further information on the impact of expanded Medicaid and how it relates to the quality of care people receive. Thank you for your time.